Good morning. My name is Dr. John Billeter, and I'm with Hanover Animal Hospital. The purpose of this video is to go over the details of a good, thorough physical exam so that we can hopefully help you to understand the value and the importance of having one done. Most people are aware that 1 year to us is approximately 6 or 7 years in the life of a dog or a cat, so that if you go to the doctor every 14 to 21 years, that's equivalent to taking your dog to either the veterinarian for every 2 or 3 years. And it's important to do that annually because a lot of changes can occur in 1 year. This is Jackson. He's helping us out this morning, so we're going to kind of demonstrate how to do a physical exam. Purpose basically being so that you can understand when you go to your veterinarian or if you come to us that what we're doing when we're doing the physical exam and trying to determine what, if anything, may be wrong. I like to start at the head and work my way back. Everybody has their own technique. Everybody has their own style of how to do this. What's important is that you're thorough and you take advantage of some of the things that nature has provided, primarily symmetry. If we look at Jackson, he's got a left side, he's got a right side. They should be essentially symmetrical, and that applies to joints and the head, the skull, really looking at him in a lot of different ways. So we're going to start up at his nose, and we want to look at his nose, make sure there's no discharge, make sure there's no abnormalities in the contours. We're going to lift his lip. We're going to look at the color of his gums. They should be nice and bright pink. We're going to press lightly on that. It should blanch out white and then come back within about 1 or 2 seconds to the nice bright pink. He's got a little bit of tartar and calculus accumulating on these teeth, so we'll need to get those cleaned eventually. So those are things we want to look for. If they're particularly cooperative, you want to look inside the mouth, making sure that everything in there looks good. There are no tumors, there's no loose teeth or broken teeth. And as I'm doing this, I'm always going to be moving my hands around, feeling the ears, feeling the submandibular lymph nodes, feeling the salivary glands, making sure there aren't any problems there. I may then go ahead and take either an ophthalmoscope or the head of an otoscope and look at his eyes. I'm looking for symmetry. I'm looking for equality in the size of the pupils. I'm looking for the reaction to light. I'm looking for clarity in the cornea, clarity in the fluid in the front part of the eye. Those are all things that are very important and can give you clues as to what you may be dealing with if there are problems. Most people do not have an otoscope at home, but they're extremely helpful because when you look in their ears, they can appear to be totally normal on the external ear canal. But dogs have a very long L-shaped ear canal, and so it's important to be able to take the otoscope and look down into both portions of the ear canal and examine the eardrum if you can, if there's not a lot of debris or hair or things like that that are occluding your view. Jackson's being nice and cooperative. As I move down, I want to go ahead and feel right in front of his shoulders. There are lymph nodes in front of the shoulders. There are also lymph nodes up underneath the armpits or the axillary area, and you want to feel those for any enlargements, any lumps or bumps or swellings. And as I said, as I'm doing this, I'm running my hands down over his body, just feeling the contours, just seeing what his overall body condition is, seeing if he's overweight, running my hand down his back, trying to feel if there's any sort of pain or abnormal response. And again, most people don't have stethoscopes at home. I'm not going to demonstrate listening because it's beyond the scope of this video, but you want to be able to, when you take a stethoscope and listen to them, you want to listen to their heart, you want to check the rate, the rhythm, you want to listen to the lungs, make sure they sound clear, there's no abnormal sounds, there's no abnormal dullness. I oftentimes like to also, as I'm checking their heart rate with the stethoscope, feel on the inside for the femoral artery so that I can make sure that they have pulses that are beating along with the heart. In male dogs, obviously you want to check their external genitals, make sure there's no swellings, lumps, bumps, discharges. If it's an intact male, you ought to palpate both testicles. And obviously in most male dogs also you ought to go ahead and check the prostate, which I'm not going to do here because Jackson is in fact neutered, but it is an important part of the exam. In female dogs or cats, and obviously all of these comments will apply equally to cats, you want to make sure that in a female dog that they don't have any excessive discharge or any discharge. Things are not irregular, and it's important to understand that what you've got to do is be able to recognize what is normal before you can recognize what is abnormal. At this part of the exam, I would also generally do abdominal palpation, and I'm feeling for any evidence of any enlargement of organs. I'm feeling for swellings, I'm feeling for fluid, feeling for anything that seems irregular. It is probably also beyond the scope of this video to try and teach people how to do abdominal palpation, but it's a difficult skill to learn. It takes a long, long time to really do it well, but it's a very important part of the exam. The last part I would probably recommend, or the last part I would comment on, let me turn him back around, is a very important part of the exam, and that is one that I probably should have mentioned from the very beginning, and that is that when you come into a room or you look at a dog or a cat, you want to watch for their overall level of mentation. Are they bright? Are they aware? Are they able to walk around unassisted? Are they limping? Do they seem to have a head tilt? All of those things can again be subtle clues and indicators as to what the problems may be if in fact they're having difficulties. That should give you the basic idea of what a physical exam is for, what we intend to learn or what we try to learn. I hope this has been helpful, and we'll be doing some more videos in the future that hopefully will clarify some more things that we do here at Hanover Animal Hospital.